session, we'll discuss about Incovac, the new nasal vaccine developed for COVID by Bharat Biotech. It is not painful, and we'll discuss more about it. We know how polio was eradicated from the world with oral polio vaccines, 2 drops. The 2 drops that changed the world. Now the nasal vaccine has come up in helping us with COVID. This is the vaccine information that is taken from the Bharat Biotech website. If you can see here, this is a summary of the trial that is done by Bharat Biotech. And after giving the vaccination, very good immunity is being provided by the vaccine, and there is no spread of infection among the carriers, and there is no community spread. So they are given with a disclaimer that the findings are provisional and final results may differ. And the vaccine also shown promising results in the animal protective studies. So is a vaccine licensed? Yes, CDS, CIVO India has granted permission for the sale and distribution of Incovac for age group of more than 18 years as per restricted use in emergency situation. That means if a pandemic arises. So nasal vaccine stimulates good immune response. It produces neutralizing antibodies and mucosal antibodies that prevents the spread of infection from individual to individual and decreasing the disease burden. How is the vaccine given? It is given through the nose, as you can see in this picture, 2 doses, 1 month apart, and 4 drops are given into each nostril. So you can see how the immunity is being produced, and there is prevention of transmission and prevention of growth of this virus. The main advantage of the nasal vaccine is it is non-invasive, there is no needle, and easy to take for all the people, even the children. Very easy to give. No special healthcare professionals are required. Anyone can give. We don't have any needle for that. And who should get Incovac? In case a pandemic rises, anybody who is above 18 years can take the vaccine. And there is no chance of getting COVID-19 after taking this Incovac vaccine. What about immunocompromised and HIV individuals? And they might be at risk of severe COVID-19, but we don't have a data currently available. And we should also remember that in these immunocompromised patients, cancer patients, chronic kidney disease, chronic liver disease patients, full immune response may not be generated. What about vaccination in pregnant women? In pregnancy, in the first trimester or the first 3 months, the new organs start developing in the baby. So during that time, the vaccine is generally not given. After that, we can take vaccine. So Covaxin and Covishield both are there. Both can be given to the pregnant lady after 3 months. But if there is any history of blood clots in the past, and there is a recommendation for Covaxin. However, as of now, the Incovac vaccine, nasal vaccine, is not approved for pregnant women. Why should we think about it? Because there is 70% higher risk of death, 2 times risk of ICU, and 4 times risk of these complications, and there is a 2 times risk of stillbirth and preterm delivery, that is a baby death. Benefits of the vaccine is it is just very easy to be given, 2 doses 4 weeks apart, and still precautions, safe COVID precautions should be followed. In case if there are any allergic reaction to previous dose of this vaccine or ingredients of this vaccine, or if the individual person is having any infection or fever, then he cannot take that vaccine. Other allergies are not contraindications. When you go for vaccination, tell your medical conditions, allergies, what medications you are taking. Are you having any fever? Are you immunocompromised? Are you pregnant? These details to the vaccinating officer. Hope this helps. Thank you.